Welcome to Veterans Speak, a platform dedicated to giving voice to the experiences of those who have served our nation. We delve into the complex challenges veterans face, going beyond the surface to confront the systemic issues that impact their lives. Today we're not just talking about the bureaucratic delays that plague the VA system, the long wait times for appointments, or the mountains of paperwork. We're confronting something far more insidious: deadly mistakes. These are errors in judgment, oversights in care, and failures in the system that can have devastating, irreversible consequences. We aim to shed light on these critical issues, offering a space for veterans to share their stories and advocating for meaningful change. Today's episode takes a hard look at what happens when the vital doctor-patient relationship breaks down. What happens when doctors, burdened by heavy workloads or influenced by systemic pressures, simply don't listen to their patients? What are the ramifications when diagnoses are rushed, incomplete, or just plain wrong? And what is the ultimate cost when these diagnostic failures put veterans' lives at risk? We'll explore real-life cases, examine the contributing factors, and discuss the urgent need for improved medical practices within the veterans' healthcare system. We'll hear from veterans who have experienced these failures firsthand, sharing their struggles and their fight for justice. I am a chaplain, and I am sick and tired of how those who put their lives on the line for our freedom are treated. "It's just anxiety," they said, a phrase that echoes in the minds of countless veterans who have sought help for genuine physical ailments, only to be dismissed with a wave of the hand and a prescription for anti-anxiety medication. This casual dismissal can mask serious underlying conditions, delaying crucial treatment and allowing diseases to progress unchecked. The consequences can be devastating, turning treatable conditions into life-threatening emergencies. But it wasn't just anxiety, it was cancer, a silent killer growing within, undetected and untreated because the initial symptoms were misattributed to stress or psychological factors. The delay in diagnosis meant the cancer had more time to spread, reducing the chances of successful treatment and significantly impacting the veteran's quality of life. This is a stark reminder of the importance of thorough medical evaluations and the dangers of dismissing patient concerns without proper investigation. The failure to recognize the true nature of the illness represents a critical breakdown in the healthcare system, a betrayal of the trust placed in medical professionals. They told me to take deep breaths, to relax, to manage my stress, but the problem wasn't stress, it was a physical ailment, a cyst growing in my brain, pressing on vital tissues and causing a range of debilitating symptoms. This cyst, a tangible and treatable condition, was overlooked, dismissed as mere anxiety. They never caught it, never ordered the necessary scans, never listened closely enough to understand the true nature of my suffering. The consequences of this oversight were profound, leading to unnecessary pain, prolonged suffering, and a delayed path to recovery. Across the country, from bustling urban centers to quiet rural communities, veterans are facing similar challenges. They are being misdiagnosed, their symptoms misinterpreted, their concerns dismissed. This isn't an isolated incident. It's a systemic problem that affects veterans in every state, regardless of their age, gender, or branch of service. The sheer scale of the issue demands attention and action. We must acknowledge the widespread nature of these diagnostic failures and work together to implement solutions that protect the health and well-being of our veterans. Under-evaluated, their medical conditions not thoroughly investigated, their symptoms not taken seriously. Veterans often report feeling rushed through appointments, their concerns minimized, their medical histories not fully reviewed. This lack of thorough evaluation can lead to missed diagnoses, delayed treatment, and a worsening of their overall health. The pressure to see more patients in less time can compromise the quality of care, leaving veterans feeling unheard and underserved. And lost in the system, their medical records misplaced, their appointments canceled, their pleas for help unanswered. The bureaucratic maze of the veterans' healthcare system can be overwhelming, leaving veterans feeling isolated and abandoned. Paperwork gets misfiled, test results get lost, and communication breaks down, creating a frustrating and often detrimental experience for those who have served our country. This systemic inefficiency not only delays access to care but also erodes trust in the system itself. There's no follow-up after appointments, no proactive outreach to check on their well-being, no clear path for addressing concerns, no answers to their questions, no explanations for their symptoms, no reassurance that they are being cared for. Just silence, a deafening silence that amplifies their suffering, leaving them feeling alone and forgotten. This lack of communication and support can be incredibly damaging, both physically and emotionally, hindering their recovery and diminishing their hope. I kept asking for tests, for further investigation, for someone to listen to my concerns. I knew something was wrong, but my pleas were met with resistance, skepticism, and dismissal. They kept brushing me off, attributing my symptoms to other causes, refusing to acknowledge the possibility of a more serious underlying condition. This constant denial and lack of support left me feeling helpless and frustrated, delaying my diagnosis and ultimately impacting my treatment options. By the time they finally found it, after months of persistent symptoms and repeated requests for testing, it was advanced, having spread beyond its initial location and significantly impacting my prognosis. The delay in diagnosis had allowed the disease to progress unchecked, reducing my chances of successful treatment and leaving me with a more challenging and uncertain future. This late-stage discovery is a tragic consequence of the initial misdiagnosis and the failure to listen to my concerns. Misdiagnosis isn't just a simple mistake. It's a dangerous oversight that can have life-altering consequences. It's a betrayal of the trust placed in medical professionals, a violation of the oath to do no harm. It's a failure to provide the care and attention that veterans deserve, a disregard for their sacrifices and their well-being. This breach of trust can have a profound impact on veterans' mental and emotional health, leaving them feeling vulnerable, disillusioned, and hesitant to seek medical care in the future. But even where human care is careless, where systems fail and trust is broken, Christ still heals. His love and compassion transcend the limitations of human institutions, offering hope and restoration in the face of adversity. Even when medical science reaches its limits, the power of faith and divine intervention can bring comfort, healing, and a renewed sense of purpose. But I will restore you to health and heal your wounds, declares the Lord, a promise of hope and restoration that resonates deeply with those who have suffered from misdiagnosis and inadequate care. This verse offers solace and reassurance, reminding us that even in the darkest of times, God's healing power is always available. It's a testament to His unwavering love and His commitment to restoring us to wholeness, both physically and spiritually. Jeremiah 30:17, a powerful reminder of God's promise to heal and restore, a beacon of hope for those who feel lost and forgotten in the complexities of the healthcare system. This verse serves as a source of strength and encouragement, reminding us that we are not alone in our struggles and that God's healing hand is always within reach. It's a testament to His unwavering love and His commitment to our well-being. God sees what others miss, the subtle symptoms, the underlying pain, the unspoken fears. He understands the complexities of our bodies and minds, and He is aware of the challenges we face in navigating the healthcare system. And He never forgets to follow up, to provide comfort, guidance, and healing in His own perfect time. His watchful care extends to every aspect of our lives, ensuring that we are never truly alone in our struggles. What they miss, what doctors overlook or dismiss, can ultimately cost a life, a future, a family. Healing starts with being seen, with being heard, with having your concerns validated and your symptoms taken seriously. It begins with a compassionate and attentive healthcare provider who is willing to listen, investigate, and advocate for your well-being. This genuine connection and understanding are essential for accurate diagnosis and effective treatment. If you or someone you love is struggling to be heard, if you're facing misdiagnosis, delayed treatment, or inadequate care, don't give up hope. There are resources available, advocates who can help, and a community of veterans who understand what you're going through. Keep fighting for your health, keep seeking answers, and never lose faith in the possibility of healing and restoration. Remember, you are not alone, and your voice deserves to be heard. Visit elshaddaichristian.com for support, encouragement, and inspiring stories from veterans just like you, who have faced similar challenges and found strength in their faith and community. Connect with others, share your experiences, and discover resources that can help you navigate the complexities of the veterans' healthcare system. Find solace, inspiration, and practical guidance as you embark on your journey to healing and wholeness. If this message spoke to your heart, if you found it informative, inspiring, or helpful, please like, share, and subscribe to our channel. Your engagement helps us reach more veterans and raise awareness about the critical issues they face. By sharing this message, you can contribute to a larger conversation about improving veterans' healthcare and ensuring that their voices are heard. Someone out there, a veteran struggling in silence, a family member feeling helpless, needs to hear this message of hope, healing, and unwavering support. Your simple act of sharing can make a profound difference in their lives, offering them comfort, encouragement, and a renewed sense of purpose. Together, we can create a community of support and advocacy that empowers veterans to overcome their challenges and live fulfilling lives.